So my name is Dr. Sara Hoffe, and I'm a practicing radiation oncologist at Moffitt, where I've worked for the last 17 years.
After you got in touch and started cooperation with the Kozlowski Family Foundation, what did you find and what happened after the first steps and beyond?
So I've been very fortunate at Moffitt Cancer Center. I have worked for many years with an amazing physicist named Qatim Latifi. And through working with Qatim Latifi, I became aware of the Kozlowski Family Foundation. And through the partnership with Qatim, we have now been doing more work. Our work primarily stems in virtual reality. So when patients come in and they're having cancer, they feel fear, anxiety, distress. And so we're interested in having patients and potentially caregivers put on the headsets and see if we can change their experience. Can we put on a relaxing ocean environment or a relaxing wave environment or desert environment, whatever people find relaxing, and can we change their point of view so no longer do they really have fear and anxiety about the treatment?
Today, you are attending the gala. Can you explain more about your feelings, let's say, and your expectations for this?
Today, we're very lucky to be guests of the Kozlowski Family Foundation and the executive director, Fotini. We support Moffitt Cancer Center's mission. Our mission is focused on patients, and our mission is also focused on the future. How can we prevent more cancers? How can we cure more cancers? And so it's extremely important tonight that the community comes together for this big event. And tonight, you're going to really feel the power of innovation in the room. People are coming together to develop the future and see how can we cure cancer faster. And so tonight, by virtue of the Kozlowski Family Foundation, we have doctors, we have patients, we have caregivers, we have people all coming together, united, to see if we can find a cure for cancer.
I see that you have enough connections, and first of all is to help people in need. How do you manage to connect with them?
Yeah, I practice in Florida, and so there's a lot of patients, unfortunately, who are aging, and our aging population, unfortunately, develops cancer at a faster rate. But even more concerning to me lately is the incidence in young cancer patients. I personally have patients in their 20s and 30s with colorectal cancer, pancreatic cancer, esophageal cancer. And so we really think of the community that's affected, it affects everyone from a young age to an old age. It doesn't matter who you are. And so we really need to do more research. We need to find ways to prevent cancer and identify it earlier. How can we identify it at the earliest stage? Because if we can identify it at the earliest stage, then potentially we can have a greater impact. Sometimes in cancer, it's not even just about cure, it's also about function. I practice in the GI tract, and I have patients with rectal cancer. So imagine if we can do a better job, not only curing our patients, but imagine a future where they don't need colostomy bags anymore. So we're focused on that. How can we cure more patients, and how can we optimize their function so that we retain a preservation approach, organ preservation? And so I think that we have a lot more work to do, but we're at least going in that direction.
This is our first meeting together, but I'm very impressed by the way it went. During the interview, you mentioned names of two doctors, one of them Dr. Latifi, who I'm honored to say is of Albanian descent. Can you tell us something more about him? The second question relates more to you, what you do.
Yes. So I've been very fortunate that I actually came to know Qatim Latifi when he was a student. So when he was a student, he came to Moffitt Cancer Center after he became a physicist, and he was in his early days. And I was very fortunate as a faculty member to see Qatim, because I could see he was amazing even at his earliest days when he was a student. And so with Qatim, I began doing projects together. We began collaborating together, and I am just thrilled at where his career has gone. He currently is the director of adaptive therapy for radiation oncology. He is somebody who has vision and really has passion for the patients. And I will tell you personally, I can email Qatim at 10 o'clock at night with a patient problem. I always get a response. He always is focused on what he can do for the patients. And it really was through Qatim that he told me about the Family Foundation. And I became aware of the foundation and then had the good fortune to meet Fotini and immediately thought saying, what could we do to make things better? What could we do to improve the health of the community? What can we do to cure more cancers? And what can we do really to improve the experience? And Quatim was really, for me, my gateway to seeing what the Kozlowski Family Foundation is all about.
You revealed in the next section that you're working on a lot of screenwriting. You also mentioned your video making skills. Where does that stand? How will you continue working with the Kozlowski Family Foundation and your project?
Yes, so thank you. The thing we're most excited about is taking virtual reality. And sometimes I know when people hear virtual reality, they think, what does that really mean? Well, what it really means is to be able to take a headset on and transport the person who's putting the headset on to an entirely new space. And if you think about what cancer patients go through, all the anguish, all the suffering, all the anxiety, and all the fear, imagine if we could just change that by putting on a headset. And so that's what I currently am working on with the Kozlowski Family Foundation to try to pioneer that. My group has already had some success. We pioneered developing something to desensitize patients before they went into a machine that looks like an MRI. So you can imagine when you tell a patient you're going to go into a machine that looks like an MRI. Yes, for radiation treatment, actually. They have to go into a machine that looks like an MRI. It's an enclosed space. They have to be in there for an hour.
There's a phobia in there.
Yes, there's a huge claustrophobia element, but you can imagine if you can go into a headset and you can desensitize that you can actually do the experience. And a real life story was I had a patient, and the patient I talked to and I said, this is what we need to do. The patient said, oh no, I don't think I can do that. I'm way too claustrophobic. The very next day he canceled the appointment. And so my nurse came to me and she said, Dr. Hoffe, you're going to have to cancel this patient's appointment. And I said, no. I said, let's not cancel. Let's try the virtual reality experience. We put the headset on him. He came out of it. He said, you know what? I can do it. He said, really help me see what it was going to be like, and I can actually do it. And so we're very excited to take that and move it to the next level. That particular experience, we did win 13 Telly Awards. We've also collaborated with Ringling College of Art and Design. So that's an amazing art school in Sarasota, Florida, number 3 in the world, actually. And we've collaborated with them. And so now we want to take that work and we want to really pioneer the relaxation phase. How can we ease the burden of cancer patients who are suffering? And I've even asked Fotini and her son to be collaborators on our next project because I want more perspective. It's fine to have the doctor's perspective, but we need real life perspective of what this means to somebody who could be going through it. So one of the important things I think medicine needs to do is embrace technology. And one of the biggest technologies that we have coming down the pike, if you will, is virtual reality. Virtual reality is a type of innovative technology that transports anyone who wears a headset into a different place. Medicine is starved for something like this. And traditionally, medicine you might not think of as the natural creative landscape to house something like this. And that's why I think partnerships are so important, partnering with patients to design virtual reality experiences that capture what they go through, and also partnering with creative partners like the Ringling College of Art and Design. So my job at Moffitt, one of the hats that I wear, because I wear different hats, is actually I'm the director of XR and innovation. So XR is not only virtual reality, it's also something we called mixed reality and something we called augmented reality. So I am the director of all of that in our Department of Radiation Oncology. And one of our physicists on staff, Quatim Latifi, and I work very closely in that regard. And in that regard, we've been very fortunate to have very helpful funding from the Kozlowski Family Foundation to get our work started. And this is a big process because you really need a team of people to figure out what is going to be the most effective when a patient is laying in the dark in a treatment room going through some of these procedures that we have to do in medicine. So I've been very fortunate to have the support of the foundation as well as a really amazing team at Moffitt. I have physicists, I have behavioral psychologists, I even have a futurist who used to work at Paramount Pictures out in Hollywood. And my futurist is on the board of Moffitt, and he's very forward thinking. What are things going to look like in the future? How can we tell a story that's going to be the most engaging for the person who's going through it? And so that whole experience has been really helpful, especially in medicine, because there's not currently much in medicine with virtual reality other than pain management. Sometimes people can wear a headset and it helps with pain. Or you might hear distraction therapy, like being in the dentist's office, putting on a headset, and then you're not aware of the dentist being in your mouth. But in the actual cancer space, we have been lagging behind on how virtual reality can help our patients. So I think it's a very important mission that we really have to band together, and we have to do everything we can to improve the experience for the patient to the point where in the future, maybe we can change their immune system. Think about it. When a patient goes through an experience like this and they're fearful and they have a lot of anxiety, they're probably, immunosuppressed. Their immune system is probably down. Well, imagine if we can use very positive imagery in a virtual reality headset, can we actually change their immune system? And if we can change their immune system, can we change the course of their experience and potentially the course of their treatment? So these are some of the things we think about. These are some of the things that we try to innovate around. And so grant funding from foundations like the Kozlowski Family Foundation and other government resource grants are really critical to try to move that mission forward. And one of the important things is what's called a goals of care conversation. When a patient comes in with cancer, it's important that the practitioner really understand the goals. If a patient unfortunately has cancer that's spread, maybe their most important goal is to make it to their son's graduation or their daughter's wedding. And it's so important for the physician to connect with that patient and really have a dialogue about their emotions that they're going through and how the treatment can intersect with that to give them the best outcome. Because the best outcome may not be cure, but the best outcome may be they can live long enough to experience something. And that's actually something we're getting better at teaching our trainees. So where I work, we have a course. We have many courses actually, but we teach these young residents in radiation oncology. And what I do is I teach the leadership course. And so the leadership course is an emotional intelligence-based class that gets at trying to help physicians lead themselves so they can be their best self for their patients, and then really have that empathy button so that they walk into a room, they can experience what the patient's going through by listening to them and understanding what their priorities are, so that the patient leaves the room thinking, wow, my doctor understood me, my doctor listened to me, I trust my doctor, and I trust that I'm going to have the best care in this doctor's hands. That is something that we're really focusing on with academic curriculum with our young trainees. I also run a leadership journal club where we'll take a leadership topic and we'll have young trainees discuss it, because the doctors of tomorrow have to be very fully informed, not only about the best science, but about the best emotion and the best medicine and the best understanding, if you will, of what a patient and family is going through. And I think that's one of the things that's sometimes neglected. What is the family going through? We know what the patients may be going through, but what about mom, dad, brothers, sisters? And we really need to focus on family-based care so that we give the best treatment to everyone. And so that's something we've been focusing on for the future generations. And we just put in a grant together, actually with Fotini, we put a grant in together of using something that was developed by my colleague at Moffitt. I have a colleague named Dr. Brian Gonzalez who developed this mindfulness application in virtual reality to do exactly that. You put the mindfulness, you put the virtual reality headset on, and then it walks you through a nice relaxing meditation. You can choose the sound, you can choose the music, you can choose the scenery. We've tested it at Moffitt, we've tested it on patients, and we've tested it on staff. I've had, uniformly greater than 90% satisfaction rates where everybody who did it said, can we do that again? I had one patient who asked me, Dr. Hoffe, can I do that every day before treatment? Can I wear that headset every day? And so I think that's where the future is going, is how can we train people to relax? And how can we get them to plug in and do it? And I personally think that virtual reality might be the best way to do it. Now, what I don't know is what's the best way to scale that so that more patients can have the opportunity. Should we in the future give patients a headset at the time of initial consultation, and should we send it home with them? So then when they're at home, they have the headset at home, they can practice. And then when they come back a few weeks later for their first treatment, they're much more relaxed and they're much more engaged. My hypothesis is that they'll be better able to tolerate the treatment. They'll be more adherent to the treatment. They'll be more compliant with the treatment. And my hypothesis is that their outcomes will actually improve. Now, that's something that requires a lot of research and funding and money, and we're looking to get that in the future. But just imagine that if we could just change the experience of the patient, and just by doing that, we could improve their cancer outcomes. How amazing would that be? So things like that, that's what really gets you up in the morning and gets you excited and saying we can really change people's outcomes.
And that time is not enough.
Yeah.
You have to work hard on this.
Yes. Well, because I do believe in engaging the patients. So I will tell you, I'm very much a proponent of visual education and visual learning. I think that if I am sitting talking to a patient and the family and they don't understand what I'm saying, not only does that create fear and uncertainty, well then they're not going to be likely to do what I told them to do because they didn't understand it. So imagine if I could visually explain that to patients, perhaps with a virtual reality experience before they do it in real life so that they can understand it. And perhaps when I see them in initial consultation, using visual videos and visual images to explain where their cancer is and explain what the treatment is. And so I think that's the future. I think the more that we empower patients and their families to know what's going on, I do think the better outcomes they will be. So that's hopefully the future. Well, I can tell you at Moffitt Cancer Center, we're very much grounded in science. So everything we do is based on clinical evidence. So it would be much more difficult for anyone to introduce a bias like that and manipulate a patient, because what we do is based in science. Everything we do is
for the benefit of
the patient, because we have review boards. You cannot do any research like at my center, at Moffitt Cancer Center, until it passes the ethics of the institutional review board. We have to write protocols that are reviewed by teams of scientists. So I think anybody can be pretty well assured in an academic medical center that the science is very sound, the ethics are very sound, and the only reason to do a study like that is to improve the life of the patient or improve the outcomes of the patient's cancer. And so that's what we've been focused on. And I'm very lucky in my department at Moffitt Cancer Center that I work in the Department of Radiation Oncology, and our physicists are very much on the same page. One in particular, Dr. Latifi, we've worked with very closely to develop some of our virtual reality work, and they really see it as improving the understanding of patients. Because let's face it, when you're a patient and you're told you're going to undergo radiation therapy, it conjures up all sorts of fear and anxiety. And so if we can really demystify that for patients, I think the futures will have better outcomes.
So the sights and sounds, how do they come together for this kind of therapy? What do you select? How can you have your own library for this, for patients?
Yeah, so the library that you actually have is we create ourselves. So Dr. Gonzalez, who's a behavioral psychologist, he actually developed this mindfulness training. He's a behavioral psychologist, so that's part of what he does. He developed these mindfulness meditations that are scientifically grounded. One might be music, one might have chanting, one might say, okay, visualize the top of your head, now go down and feel your shoulders. He is an expert scientifically in doing that. And so our virtual reality program at Moffitt has all of those choices. So you as the patient, you can pick which experience you want. You can picture if you want to be at the ocean, or if you want to be next to a babbling brook, or you want to have a different experience. And this is just the tip of the iceberg, because somebody like me, I want the future to have gamification. I want to actually include games. So maybe before the patient gets into the mindfulness meditation, maybe we engage them with a fun little game. We did that in our first virtual reality project, where we had a golf game. So by holding their breath, which was the desired outcome, the golf ball would go into the hole. And so that created a little sense of euphoria for patients, so that then when we demystified the MRI experience and literally in virtual reality had them slide into the machine, they were much more relaxed. So I'd like to see the future more gamification in virtual reality and AI. because I worry about my patient who's 80, who's never been in virtual reality before, and I worry, how is that patient going to be in the experience? If the experience is 12 minutes, does that mean I have to send a staff member to sit next to my 80-year-old patient for 12 minutes? We don't have those kind of staffing levels. So imagine if you program artificial intelligence into the program, and then the artificial intelligence can coach my 80-year-old through each step of the journey. That's where the future is, and hopefully we'll head there soon.
Dr. Hoffe, I really appreciate all the information you provided me for our first interview, and I believe we will meet each other again in the future.
It would be a pleasure. It would be a pleasure. Anything else you need me to say?
Thank you very much, Dr. Hoffe.
Okay, it's a pleasure. Thank you so much.